Welcome to our webinar on risk management and operational excellence in healthcare information technology, also known as HIT. In HIT, effective risk management is essential for protecting sensitive information from cyber attacks and breaches, as well as ensuring compliance with regulatory frameworks like HIPAA. Meanwhile, operational excellence requires optimizing processes, improving efficiency, and delivering high-quality services seamlessly. I'm joined today by Michael Meis, Associate CISO of the University of Kansas Health System, a leading academic medical center that provides critical care across Kansas and beyond. As CISO, Michael is responsible for balancing operational efficiency with robust cybersecurity measures to protect patient data and medical systems. This challenge is especially pressing in today's threat landscape, where healthcare now accounts for 32% of all recorded data breaches, with the average breach costing $11 million. In the course of the session, Michael and I will cover the complexities of managing risk and ensuring operational excellence in high-stakes environments like HDOs, and why they're often seen as competing priorities, how organizations can define and navigate acceptable risk, and the dangers of allowing it to accumulate over time, the importance of accountability and proactive remediation in preventing misconfigurations and resolving security gaps before they take root. Michael will also share his firsthand experiences in tackling these challenges. And finally, we'll open the floor to your questions at the end. There's a lot to cover, so let's dive right in. So I'm David, Strategic Account Manager at Remedio. We specialize in secure endpoint configuration and proactive, non-disruptive remediation to help organizations maintain policy compliance and strengthen operational resilience. Michael, it's great to have you here. Would you mind telling us a little bit about yourself and your work at UKHS?
Yeah, absolutely. So I've been in cybersecurity about 15 or 16 years or so at this point. I started in the government space first as a member of the Army, and then supported federal governments through cybersecurity, various cybersecurity roles across Department of Agriculture, Department of Defense, and Department of Energy. I spent a couple of years at H&R Block rebuilding a GRC program where we tackled a lot of these questions around risk management from a global operational perspective. And then I've been at the University of Kansas Health System for nearly 4 years now, where I run our cybersecurity, identity, IT disaster recovery, and AI governance efforts.
Awesome. That's quite the experience you have, and certainly thank you for your service. We appreciate that.
Thank you.
So risk management is a broad field, but in healthcare IT, what does it specifically entail? And what are the key daily tasks and major concerns?
Yeah, so I think when you're talking about information technology, it's obviously a challenging field anywhere, but it's especially challenging when you're talking about it from a healthcare perspective. And there's some pieces of it that make it really challenging. So first, when you're defining healthcare IT, you're really talking about the systems that enable the health system or hospital to deliver clinically, to be able to operate and provide care to patients across the entire care spectrum. And I think that's really important to nail down that definition, because it also talks about the goal of why are we doing all of this. It's not to build really cool systems, it's to be able to care for patients. And so when you're talking about from a risk management perspective, that also becomes front and center. Is what does doing or not doing this, what is the potential impact on the organization's ability to deliver its mission, which is to care for patients. And I think the health system does a really good job at prioritizing that and kind of putting that front and center, but it's something that is at the front and center for every healthcare organization, and makes the objective of securing those systems that much more difficult, but also that much more important.
Yeah, I tell you what, so much of my career has been focused in healthcare, and that's something that I've truly appreciated, is that view of how does this impact the patients and patient care, which is valuable. So one of the things with healthcare is the constant state of consolidation, certainly adds to the complexity of HIT management. And of course, M&As introduce a huge challenge in terms of golden image deployment and enforcement across diversified and distributed fleets. You having recently gone through an acquisition of another health system, can you tell us a little bit more about that?
Yeah, absolutely. So you're right, the healthcare industry as a whole is consolidating significantly. There's a lot of macroeconomic challenges that unfortunately the regional and critical access hospitals are really struggling to adapt to. And so we're seeing a large scale consolidation towards kind of the larger health systems and health delivery networks. And it does present challenges, both from an operational perspective of, different hospitals may do different clinical procedures the exact same way. But from a technology and cybersecurity perspective, it presents numerous challenges. Oftentimes, different hospitals are using different EMRs. How do you bring those together to be able to share patient records and create that seamless patient experience, whether they're, visiting one of the locations you recently acquired or one of the quote unquote legacy locations that had already been there. And then, every organization has their own level of technical debt. Anybody who tells you they don't have any is probably trying to sell you something. And so not only do you have your technical debt, but now you're also inheriting another organization's technical debt. And so it becomes really challenging from a variety of perspectives to be able to enable that patient experience and make it as seamless as possible, but also understand the amount of risk that you're taking on as an organization, and then how you want to go about managing that. The health system, I think, does a really good job at prioritizing cybersecurity right out of the gate. My team is able to get in there kind of day one and really be a part of that due diligence process and ensuring that we have a game plan for how we're going to address the security challenges at that organization. And I think that is really first and foremost how you kind of go about approaching M&As in a way where you can make sure that it's in line with the way the organization wants to treat risk.
Yeah, good points. And the dilemma faced in HIT is that much of the systems have been developed over years, and in many cases, what's not broke, don't fix it applies. Can you elaborate on how that approach can get you into trouble?
Yeah, I think you hit the nail on the head. Is that the focus on clinical care can sometimes lead to decisions that impact clinical care negatively. So when you're talking about a clinical care system that has been in there for 20 years, it works, it gives the doctors what they need, and they're able to care for patients with it. It can very much easily lead to an attitude of, okay, we're able to accomplish our mission, which is taking care of these patients, but this system is running on an end-of-life piece of software. It's still using legacy authentication, legacy encryption that's easily defeated now. And so unless you're looking at protecting the ability to deliver patient care in more holistic terms than can I see a patient today, it's very, very easy to kind of fall into that trap of, if it ain't broke, don't fix it. And then as those accumulate over time, you kind of dig that hole deeper and deeper to where it takes more and more dramatic action in order to be able to kind of start bringing the health system up to a more modern and supportable state.
Yeah, and you're kind of getting into the topics of technical debt, but also in terms of the security stack. And can you tell us a little bit more about the tools you're using to overcome some of those challenges, and even maybe where some of them might fall short?
Yeah, absolutely. So as anybody will tell you, the number of cybersecurity tools just continues to grow every year. There's a new acronym for a tool that I need every other day. And like many overall IT budgets, we're also looking at how can we be more efficient with our security spend and our overall IT spend all the time. So we use CrowdStrike for our EDR. We use an industry-leading firewall provider, et cetera, vulnerability scanning. So a lot of those kind of full core functions that you really expect to be in place when it comes to protecting your organization. I think where we have many of the gaps that we have a lot of the same gaps that everyone is grappling with our security tools. Is for the past 2 decades or so, we've focused a lot on visibility. How do I get more visibility into my environment? And I think that we hit an inflection point probably a couple of years ago as an industry where we have a lot of visibility. We can see things now that we couldn't see or even dream of seeing 5-7 years ago. But now we know where there's blood all over the floor. What are you going to do to clean it up? How are you going to fix it? And so we've been focusing more on trying to pivot from just achieving visibility to making sure that we have a holistic understanding of, is this tool not only going to help me identify problems, but also help me fix them? Because at the end of the day, that's what this is all about, is we've got to fix the problems. And I think that we still need more of our security partners to kind of get in that boat of going beyond just the visibility and identification.
Yeah, and you're talking about the accumulation of these different risks, pivoting from kind of that reactive, maybe identification, getting into proactive. I'm curious, how does budget fit into the equation? With so many different tools that maybe you feel like you've already invested in, or maybe even feel required to invest in?
Yeah, budget is a challenging conversation because, to your point, we are a heavily regulated industry. There's a variety of security controls that we are required to have in place. Some of them are more useful than others, but you can't just not invest in them. And then, the insurance industry will mandate certain controls as well. And so, you end up with some things that you have no choice, you have to buy them. And then everything beyond that starts to become a question of what we call security return on investment. So we're really big into cyber risk quantification to really be able to understand how much does this tool or this set of tools or these controls go about reducing the risk that we're carrying as an organization. And then the other way that we look at it is just from a kind of pure play automation perspective. Does this save me having to invest in 3 to 5 new FTE if I can automate this process using a tool or using a new automated process? And so I think that when you do go to look for budget and planning your budget, really understanding which of your tools are providing that type of value kind of helps to not get caught up in the what I call the shiny toy syndrome of constantly chasing whatever the new marketing hype is. And you can really focus on maximizing the efficiency of that budget and stretching every dollar as far as you can.
I like that. Keeping a focus on what's important and what's going to get the job done, if you will.
Mm-hmm.
You mentioned acceptable risk throughout this conversation. Would you mind sharing more about that?
Yeah, absolutely. So the concept of acceptable risk is one that many organizations struggle with, mainly because organizational governance, especially in U.S. companies, is typically not very mature when it comes to a risk management perspective. And so we make a lot of risk decisions kind of in a vacuum. So we look at one risk individually and we say, I don't have that big of a problem with this particular decision, and we implement that decision and then we move on. But what can happen is twofold. Number one, you're either not accurately understanding the risk posed with that decision, which can happen especially if you're using qualitative risk management processes. And then the second is kind of a risk accumulation issue of if I take 100 low risks as opposed to 5 severe risks, is that more or less risk that the whole organization is carrying? And so I think it's important for organizations to understand how much risk they're carrying holistically, and be able to present that to your executive leadership and your non-executive directors, for them to be able to understand from a holistic perspective how much risk the organization is carrying, and then make decisions on that front. That authority oftentimes gets kind of accidentally delegated down to the CISO to say, is this okay or is this not okay? And I think it's really important for our CISOs to be able to obviously understand that we cannot disrupt healthcare operations, but that we need to be able to present that information to the executive owners who own those risks so that we can help them kind of